We should be focusing on, so we know where the infection is going on in this region particularly. So we are talking about drug users in our community, men who have sex with men, or transgenders, sex workers. So if the infection is usually happening within this community, then we need to focus on these communities, and that's why we need a strong presence of these population at ICAAP as well. And where the money goes right now, if we look at all the data available, how the money has been distributed, where the money is going, this population gets very little, and that's what we need to see. When we look at who are the most affected by the disease in this region, so we are basically talking about drug users, MSM, transgender sex workers, or young people, for example. And these are the populations which are already so marginalized by their own governments or the society. So when the international donors community started pulling out, so they also, all of us need to think very clearly where we are leaving them. Is it going to help the countries to push to bring more money from the country budget or not? We don't know. Getting to zero, it means very little to us. Honestly speaking, the reason why I said this is, we have been involved in this work for a long time, and the things are not going as we wanted or as we expected. So while everyone is having a hard time, trying to do things and struggling with the funding issues, struggling with the legal reforms. So getting to zero is not going to happen. So, however, to be optimistic, we can change it. We can make that happen. So, in order to make that happen, we need to put the resources into this population. Testing is a big issue. If we look at the region, majority of the people who get diagnosed, they are diagnosed so late, because they don't want to go to the hospital. If you are already so marginalized, then how can we expect them to go to the public hospital to access health care? They will access the health care only when they are too sick, and that's one of the reasons why people get diagnosed so late. And then knowing one's HIV status early is so important as well. And particularly now we know treatment can prevent sexual transmission amongst the heterosexual communities. So when we have this evidence, it's important that people get the opportunity to diagnose early, and then that will happen when we create that environment where people can come and get tested, and that can be done very effectively when this population started running their own testing programs. We are still struggling, trying to prevent infection, trying to prevent new deaths. But at the same time, when people started ignoring the disease is gone, for example, and it doesn't help basically. So, and that's why if we look at the young MSM, for example, in Thailand, a lot of the people, young people who are diagnosed in Thailand are coming from MSM community, for example. It's a similar case in the Philippines as well. So people sort of started ignoring ignoring HIV, everywhere in this region, and that is very scary as well. And so we need to seriously look at why it's happening. Community-based organizations. So right now we work with a number of community-based organizations, particularly people living with HIV groups. And every time when we talk to them, yes, they are struggling with the funding issues, with very limited capacities, but the work they want to do is massive. So without supporting them to address some of these issues, things are not going to change much. And that's what we have been seeing across this region. Yes, we might be able to save lives by putting them on treatment, but the new infection is not going to decrease much. Yeah, so And so, that's why, again, coming back to, why the community-based organization is, key affected populations are so important.